Hi, everyone. So the purpose of this supplemental lecture is to give you an example of what I'm looking for your presentation. So consider this like a platform presentation where you're trying to get through all of your material in a 10-minute time period. And so that's going to be, I think, the greatest challenge. And I think it's also a great practice for you, a great learning experience, because hopefully when you get done with your dissertation, you will be submitting two different conferences to try to present your findings. And so what you're going to do within this presentation is introduce yourself, have an introduction where you define the problem and present evidence and or identify gaps in knowledge. And you should have a purpose statement and include a hypothesis or hypotheses. The methods will describe what you will do. You might hear me talking about what I did do, but you're going to focus on what you will do, how you will conduct the study, and the statistical analyses you'll present, what statistical tests you'll utilize. And what I want you to do is link the statistical test to the data you're collecting, or with the statistical test, describe the purpose of it and how it'll help you answer your question or questions. So we'll go ahead and start now. Good afternoon, everyone. My name is Dr. Jason Brummett, and along with my co-authors who are listed here on the slide, we want to present our study, A Prior History of Anterior Cruciate Ligament Reconstruction is Associated with Future ACL Injury in Female Collegiate Athletes. So ACL injuries are a significant injury. They often lead to the end of the athlete's season. Surgical reconstruction is the primary treatment choice, and it is followed by months of rehabilitation. What is known about the topic? Is a prior reconstruction a risk factor for a subsequent ACL injury? Well, Paterno has reported that high school female athletes, they're 16 times more likely to experience an ACL injury within 1 year of returning to sport. They're 4.5 times more likely to experience an ACL injury within 2 years of return to sport. What is unknown is the risk in female collegiate level athletes. Now, the ability to identify athletes at risk for ACL injury is warranted because there is evidence that you can reduce the risk of ACL injury by having people participate in one of two evidence-based programs. Now, how has risk of ACL injury been looked at previously? Well, one test is the drop vertical jump. There's been some early promise utilizing the drop vertical jump as a tool to screen athletes. However, subsequent studies have challenged our understanding or our ability to use the drop vertical jump to discriminate ACL injury risk. So the findings have not been consistent. And another challenge is not all clinics or universities possess equipment or the technology to be able to identify different kinetic and kinematic measures during the drop vertical jump. Could other functional tests help to discriminate ACL injury risk? Shown here are the standing long jump and the single leg hop test. Prior research has demonstrated an association or a relationship between the standing long jump and the single leg hop test and subsequent non-contact time loss injury. So Brummett et al. Reported an asymmetry in single leg hop distance between legs was associated with a fourfold increase in foot and ankle injuries. Brummett et al. Also found that female athletes who had a standing long jump less than 80% of their height, a single leg hop less than 65% of their height, and a slower lower extremity functional test had a 9-fold increase in thigh and knee injuries. And Brummett et al. Also found in volleyball players having a lower standing long jump, lower single leg hop test bilaterally, and an asymmetry between legs with a single leg hop test was associated with a 4-fold increase in lower quadrant injuries and a 6-fold increase in ankle and foot injuries. So the purpose of this study was to determine the risk of ACL sprain in a population of female collegiate athletes. It was hypothesized that female collegiate athletes with prior history of ACLR would be at a greater risk for a non-contact time loss ACL injury. Female collegiate athletes with shorter preseason standing long jump and or single leg hop scores would also be at a greater risk of a non-contact time loss ACL injury. So this was a prospective cohort study. 360 subjects were included between the years of 2009 and 2017, representing volleyball, soccer, and basketball. These were all female athletes, and they were representing Division II, Division III, and NAIA levels of competition. During preseason screening clinics, we collected prior injury history, and we had the individuals perform 3 standing long jumps and 3 single leg hops bilaterally. What's shown here in this table is prior history of ACLR within the sample and the new cases of non-contact time loss injury. So within the volleyball players, there were 6 people that had a prior ACL reconstruction, 10 in the soccer players, and 4 in the basketball players. So 20 out of the entire sample of 360, representing about 6%, I believe. Nope, that might be incorrect there. Nope, actually that number is correct. My apologies. Now, at the bottom of the table are the non-contact time loss injuries per region that occurred. And so we can see that there were 31 lower quadrant related injuries in volleyball players, 37 in the soccer players, and 5 in the basketball players. There were 3 volleyball players that had an ACL sprain, 3 soccer players, and 1 basketball player. So a total of 7 people had ACL injuries during the surveillance period out of the total 360 athletes. Prior history of ACL reconstruction was a risk factor. Individuals with a prior history of ACL reconstruction were almost 7 times more likely to experience a non-contact ACL sprain during their collegiate career. Prior history of ACL reconstruction was not associated with any non-contact time loss lower quadrant injury. Now, looking at the functional tests. So our cutoff scores were standing long jumps below 80% height and single leg hops below 70% of height, and people having 70% below height bilaterally. So functional test performance was not associated with an ACL injury. Interestingly, functional test performance was associated with any non-contact time loss lower quadrant injury. So about a 1.5 to 1.6 times greater risk of non-contact lower quadrant injury during the season if they started off the season with lower jump and hop test scores. So prior history. Now, one thing that this presentation didn't do is I didn't have a good stats analysis section because this comes from an actual presentation I did at an APTA conference. And so in the stat analysis section, I would want to talk about how I would be utilizing the relative risk statistic to answer the risk based upon functional test performance or prior history of ACL. I'd want to talk about how I would have utilized descriptive statistics to calculate means based upon age. I'd be calculating counts for different injuries, things like that. Obviously the results in the discussion section, these areas are not areas that you would need to be going into, but I'm going to finish things off here just so you kind of see a full platform presentation. So prior history of ACL reconstruction was associated with a greater risk of a non-contact time loss ACL injury. However, 18 of 20 individuals with prior history did not experience ACL injury. So only 2 of the 20 athletes with prior ACLR went on to have a second ACL injury. So when you see that the risk is 7 times greater, we always have to put those things in context because, yes, they were 7 times more likely to have an ACL injury, but only 2 out of 20, right? Only 10%. So that kind of puts it in a different frame. Now, athletes with a prior history of ACLR were no more likely to experience a non-contact time loss lower quadrant injury. A battery of functional tests may help to identify athletes at risk for a non-contact time loss lower quadrant injury. Female collegiate athletes should be screened for prior history of ACLR, and more research is warranted to improve our ability to identify athletes who may be at risk for an ACL injury, because remember, there were 7 injuries that occurred. So 5 out of the 360 individuals went on to have, actually 5 of the 340, because there was 360 total, but 340 had no prior history. So 5 of the 340 had an ACL injury for the first time. What would help us identify those people better? And then, of course, at the end of any type of presentation, you would include your contact information like that. All right, so in I don't know how many weeks we'll have our poster and presentation assignments due. I don't think it's till week 9 or so. I look forward to fielding and answering any questions you might have, but that's basically what we're looking for, is no more than a 10-minute platform presentation utilizing PowerPoint.